What's that? Oh, great. It's covered by your insurance. This is great. So that's awesome. But yeah, like I said, I would not pay cash on this. You gotta take advantage of your insurance. And if you have to pay cash, no more than $100. Anything beyond that is too much. Okay, so the chemical peel we're gonna do today is it's a light peel, it's a superficial peel, because what we're trying to do is we're just trying to unroof your blackheads and whiteheads so that it'll unclog your oil glands. So what we'll do today is just basically, this is called modified Jessner's. Right there, can you see that? Yeah, it's modified Jessner's. So a modified Jessner's is a combination of salicylic acid, lactic acid, and also citric acid. So salicylic acid is good for whiteheads and blackheads because it actually unclogs your pores. And then lactic acid, it actually peels your skin. Sometimes, if not most of the time, our skin becomes sticky and becomes thicker and thicker. And that's why your skin feels ashy and feels like it's dry. And what lactic acid does, it actually gets rid of all those dry, damaged skin. So yeah, lactic acid, salicylic acid, and also lastly, it also has citric acid, which the great thing about citric acid is it actually brightens up your skin. So, Jessner's, that's the name of the chemical peel that we're using. It's perfect for the skin condition we have right now. Peeling, not so much because this is a superficial peel, maybe a little sensitive. So make sure when you're out and about, make sure to wear your sunscreen, okay? Downtime, you don't have to miss work, you don't have to stay indoors. Just make sure wear a large brim hat and also sunscreen and definitely moisturize, yes. Okay. Oh, by the way, as I mentioned, tretinoin and chemical peel literally functions the same way. Both are good for acne, but long term is actually good for you aesthetically because what it does actually, especially for deeper peels can actually regenerate collagen production, increase elastic formation, increase collagen production, and growth factors. So yes, so when you go deeper level, it actually can minimize fine lines and wrinkles. And if you start early enough, it actually can minimize wrinkles. Yes. Okay. Did you happen to wash your face before you came here? Great, that's good. Okay. So the first step. What do you wash your face, by the way? What do you wash your face with? CeraVe cleanser, great. That's actually my favorite. Yeah, I recommend it all the time. Okay, so the first thing is I know you've already cleaned your face, but we need to clean your face with alcohol. So I'm just gonna dab these things with alcohol, okay? Just gonna dab your skin with alcohol, okay? Alright. Any other question? You're nervous? Oh no, this is fine. This is a light pill, and today we're gonna only do two coats. Two coats. Stay superficial. Stings a little bit, but nothing major. Now, if we happen in the future, if we to use TCA, then you're gonna feel it because it's a deeper peel. Yes. Okay. So I'm just gonna is taking care of your white ends and black ends. Okay. Just gonna dab here. Okay. Very good. Alright. Okay. Smells a little bit. My apologies. Okay. Dab. 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 Now what I look for is frosting. That tells me that the Chestnut's peel is actually denaturing proteins on your skin. It kind of gives me an idea of if I'm penetrating the right depth for my Chestnut's peel. Yes. Okay, so that's the first coat. Alright, let me just. Okay. Alright, I'll give it about 10 seconds and I'll blow fan on your face, okay? How's it feel? Not too bad. Yeah, just stings a little bit, but Chestnut's peel, it doesn't really stings that bad. Okay, are you ready? Just the fan, okay? Just gonna fan you out here. Okay. Okay. You okay? Good. Yeah, for this, if it's covered by your insurance, I would recommend taking advantage of this benefit. Maybe every 4 months. This is great because it does a lot of things for your skin. This is not only for your blackheads, also it lightens up your skin, it smoothens your skin, hydrates your skin. Yes. Okay. Alright. Okay, are you ready for that second coat? Okay, great. I'm just gonna stop this fan, okay? Okay. Alright, second coat coming up. Alright. It's not too bad, right? Yeah. Okay, just nurse here. Okay, very good. Alright, just gonna dab here. Very good. Start your forehead here. Temple. Nose here. Okay. Cheeks. Very good. Chin. Good. Did you want me to do your neck too? I mean, I can if you want me to. That's no problem. Okay, let me do your neck, and I'll do this last because it smells a little bit. Let me just do your neck here. Very good. Excellent. And then just hold your breath for like 10 seconds. Go. Very good. Good job. You did good. Alright, give me about 10 seconds. I'm looking for frosting here. Just all white spots, white specks of spots. I'm starting to see. Okay. 5, 4, 3, 2, 1. Okay. You still need the fan? A little bit more. Okay. It's not too bad. You're good? Okay. Okay. Very good. Let me just stop the fan here. Okay, yeah, I see some frosting. So, what that means is we've gotten to the depth that we wanted, which is the epidermis. So this is great. So, our next step is I'm just gonna apply lotion. Moisturizing. I don't use lotion on the face. Just cream, CeraVe cream. Wow, I recommend CeraVe cream a lot. Right. So CeraVe here. Okay. Very good. Okay. Next is just CeraVe. Wow. Well, I can't help it. I mean, it's been great for my patients. So, CeraVe, just gonna put a little sunscreen before you leave our office here. It's pretty sunny right now outside, so I want to make sure the sun doesn't hit your skin directly. Okay, just a little tap here. Okay, just massage it in. Okay, just massage it in. Very good. Okay, just massage it in. Just massage it in. Okay, very good. Let me just wipe the excess off here. Okay. Sorry about this, I put too much here. Just wipe the excess. Just wipe the excess here. Okay, alright. Well, yeah, that was it. Easy peasy. Like I said, I've done probably almost 1,000 chemical peel, but I've learned to tell my patient, get it covered by your insurance, because this is good long term. It is something you can benefit long term, so take advantage of this. Okay, so in-home treatment is no limitations. No, you don't have to change any routine. Wash your face, moisturize, and then wear your sunscreen, and then wear a hat. Okay? Alright. Also, I'm gonna prescribe you the tretinoin. It's 0.05, but don't use it 2 weeks from today because you want your skin to heal. Okay? You want that. You're not gonna have a peel, but you want the inflammation to go down. Okay? So don't use it 2 weeks from today, but when you start using it, pea-sized amount every other night for the first month. Okay? I'd like to see you back in about 2 months, see how you're doing. Okay? Also, the tretinoin will also make your skin sensitive, so it's very important to apply moisturizer, sunscreen, and then large brim hat. Yes, yes. Okay, anything else I can do for you? No? Do you have any more questions? Okay, good. Alright, so before you leave, make a follow-up with me at the front desk. Tell them, follow up in 2 months with Al. Yes, Al, like your pal. Like the song, just call me Al, yes. Oh, by the way, I'm still establishing my clientele. So, if you like me, I hope so, please tell